In this presentation, I will talk about the removal partial denture step-by-step procedure. When this patient comes to you, you have multiple options to restore his missing teeth. One of these options is the removable partial denture. The removable partial denture can be constructed in 5 visits. The first visit, which will include the history taking procedure, clinical examination, and then decision about making a removable partial denture to this patient, and then taking the primary impressions to both arches. Mostly the primary impressions are taken by the alginate impression material, as we can see here in the right picture. After the first visit, you should make the primary casts from that primary impression. That primary cast, we will also call it as a study cast, because we will study the patient's mouth on it, and we will do the surveying procedure and the removal partial denture design procedure, and then finally we will make a special tray on it. Guys, the surveying procedure is a procedure that is done by the use of an instrument called as a surveyor, as we can see in the left pictures. The surveying procedure will locate the heights of contour of the teeth, and when we can locate the heights of contour of the teeth, we will be able to locate the place that we will put the direct retainers in, because it is mostly sub or below the height of contour. And also we may know the path of insertion and removal of the removable partial denture. After doing the surveying procedure, then we will design the removable partial denture on the study cast or the primary cast. Generally, the removable partial dentures will consist from rests and restes on the teeth that will support the denture, and it will also be composed from direct retainers and indirect retainers that will provide retention to the removable partial denture, and finally from major connectors and minor connectors, which will connect the parts of the removable partial denture, and finally a base that will support the teeth that will replace the missing teeth. After the completion of the surveying procedure and the removable partial denture designing procedure, we will use the primary cast to make the special tray. After doing the special tray, that is as we can see it on the right picture, 2 pictures, we will call the patient for the second visit. In this visit, we will do the tooth preparation, as we can see in the left picture, as we have designed on the primary casts. After the completion of the tooth preparation on the natural teeth, then we will take the final impression of the patient's mouth, and then we will do the face bow records using an instrument called as a face bow, as you can see here in this picture. And then finally do a bite registration, as we can see in the right picture. After this procedure, we will take the primary impression and then we will do boxing and beading procedure. The beading waxes will attach the boxing waxes to the casts, or the final casts, or as we call them as the master casts, and then we will pour them, and after that we will mount them on an instrument called as an articulator. As we can see here in the middle picture, these are articulators. The articulator is an instrument that will copy the TM joint and will connect the two casts. After this procedure, we will send what we have recorded to the lab. Guys, I want you to know that after the completion of this step, now we will have the exact copies of the patient's mouth that we have taken by making the primary impression procedure and then the final impression procedure. And also we have the relationship between the two jaws of the mouth. By the impression taking procedure, we have taken the copies of the two jaws of the mouth, and then by the Facebook and bite registration procedures, we have taken the relationship between these two jaws. After that, we have transferred this to the articulator, and now we have the patient mouth. Outside the patient mouth, we have the exact copy of the patient mouth outside the patient mouth, so that we can construct the removable partial denture, because until this moment no one dentist has ever discovered or developed a way to construct the removable partial inside the patient's mouth. Because if we have some materials or equipments that will help us to construct the removable partial denture inside the patient's mouth, we will not need the impressions, we will not need the articulators, we will not need any of these things, because the mouth is ready and the relationships are ready. But unluckily, until this moment, no one has developed this procedure, so that we should copy the patient's mouth and take it out and construct the removable partial denture on it. And that's what we has done until this step. Then the lab will send us the metal framework that it has made. We will check the metal framework fitting, and we will check the rests, the rest seats fitting, the minor and major connectors places, the direct and indirect retainer places. And if everything is okay, we will choose the correct shade and shape of the teeth and send them back with the metal framework to the lab, so that it can arrange the teeth, the proper teeth, on the metal framework using wax. Okay? After this procedure, and when the lab will arrange the teeth on the metal framework, he will send us the metal framework with the teeth on it to act like the original denture or the final denture, but with the wax attaching the teeth to the metal framework, not the acrylic. In this appointment, we will try this thing inside the patient's mouth, so that we call it as a try-in appointment, in which we will do two things. The first thing is to check the vertical and horizontal and rotational relationships of the removable partial denture, and that is by the articulating paper and checking if there is any centric offs or eccentric relationship, impingations, or if there is any high spots or anything like that, that will indicate there is a problem in the vertical or horizontal relationships. Also, the second thing is to check aesthetics and phonetics. Aesthetics is according to your experience, to see if the teeth are beautiful, if the patient is okay with them. We check the high lip line, the low lip line, the shade, the shape, the size and arrangement of teeth. And finally, we check the phonetics by asking the patient if they are if it is a class 4 removable partial denture or the teeth that are replaced are anterior teeth, by asking the patient to say 15. When the patient says the number 15, the upper teeth must contact the wet dry line of the lower lip, and if the teeth does not touch that, but instead it will touch the area anterior to it or posterior to it, that means there is some problem and we should rearrange the teeth so that we will have a better phonetics and aesthetics together. And after that, the lab will get the denture again and it will do the final shaping to the wax size and shape, which is called as festooning. After that, he will make the denture ready. I know this is a complete denture, but I wanted you to see the festooning or the festooned denture. Anyways, and after doing the festooning procedure, the technician will let's say cook, as I call it. He will cook the denture if it is a hot cured acrylic denture, and after that he will send it back to us completed, and then we will deliver it to the patient, check the occlusion if it is good by the articulating paper, and check the fitting of the denture if it is good by PIP or a pressure indicating paste, and then we will correct accordingly, and then we will instruct the patient that he should clean his denture at the day and put it in a water and salt at the night or water only at the night, and after 3 days he should check if there is any pain and come to us. After 1 day he should come to us and see if there is any ulcerations in his mouth, and after 7 days he will stop the excessive salivation, and after 2 months he will get used to the denture inside his mouth and he will regain the normal function and phonetics that he used to make. These things are important to be told to the patient so that he will not worry about the abnormal function, phonetics, excessive salivation, and pain that he may face during the wearing of his denture. And as we said, we should make follow-up appointments, and that is after 1 day to see if there is any source post, or after 3 days, or after 1 week, according to the possible. And then after every 6 months to check what is happening to the teeth, if there is any mobility, if there is any periodontal disease, etc. That was a summary for the steps of making removal partial denture. Thank you for improving yourself by listening to this presentation. Always try to know, try to spread knowledge, and try to construct the world. Be kind to one another, and that is for the greatest benefit to the humankind.